Ever pondered how kidney dialysis functions? A team of researchers in Alexandria, Egypt might just have revolutionized it. In the heart of the coastal city, at the National Institute of Oceanography and Fisheries, a group of bright minds has been working on a game-changing project. They've taken something as simple as agricultural waste, specifically date palm residues, and turned it into a key component of kidney dialysis technology. Yes, you heard that right, date palm residues. At the forefront of this innovative research is Dr. Safa Ragab, a highly respected scientist in the field. Under her guidance, the team has developed a new type of membrane, a marvel of modern science that promises to bring a significant shift in kidney dialysis. But what exactly does this membrane do? Well, it acts as a semi-permeable barrier in kidney dialysis machines. This means it allows waste products such as urea and creatinine along with excess fluids to pass through while retaining the essential components of the blood like red blood cells and proteins. It's a complex process, but one that's critical to the health and survival of kidney patients. In a country like Egypt, where traditional membranes are imported at a high cost, this discovery could be a game changer. These membranes are typically made from materials like cellulose acetate, derived from cotton. So by using locally abundant date palm residues, the team at the National Institute of Oceanography and Fisheries is not just creating a scientific breakthrough, they're potentially providing a cost-effective solution for kidney patients in Egypt. This is not just a scientific breakthrough, but a potentially transformative solution for kidney patients in Egypt. This innovative approach, leveraging local resources to improve patient care, is a testament to the power of science and the potential it holds to change lives. And this is just the beginning. Who knows what other breakthroughs are on the horizon? Stay tuned as we delve deeper into this fascinating journey of innovation in the following scenes. So how are these membranes made? The process is as fascinating as the product itself. Let's start from the basics. The primary raw material is cellulose, which is extracted from date palm residues. This is a resourceful approach, leveraging the abundant agricultural waste in Egypt. Once the cellulose is extracted, it undergoes a transformation into cellulose acetate. This is where the magic of science comes into play. The team uses a novel catalyst, ammonium ferric sulfate to be precise, to facilitate this transformation. The role of a catalyst is crucial here, as it speeds up the chemical reaction without itself being consumed. In this case, ammonium ferric sulfate helps convert cellulose into cellulose acetate, the fundamental component of these innovative membranes. But the story doesn't end here. The cellulose acetate then needs to be shaped into a membrane, and not just any membrane, but one robust enough to function effectively in a kidney dialysis machine. Creating such a membrane is a delicate process, one that requires precision and control. The team meticulously modulates the properties of cellulose acetate, such as its molecular weight and degree of substitution, to craft membranes suitable for kidney dialysis. This level of control ensures that the membranes are semi-permeable, allowing waste products and excess fluids to pass through while retaining essential blood components. And so, through a series of carefully controlled steps, the team transforms agricultural waste into life-saving membranes. It's a testament to the power of innovation, turning what was once discarded into a valuable resource. But it's not just about the science, it's about the people behind it. The dedicated researchers, the rigorous testing, the countless hours spent in the lab, all to create a product that could revolutionize kidney dialysis. The meticulous production process ensures these membranes are tailored for efficient functioning in kidney dialysis. Now the question is, how will this breakthrough impact healthcare and water sustainability in Egypt? Let's delve into this. Imagine the possibilities if we could harness the power of the sea to provide fresh water to millions. These membranes, currently designed for kidney dialysis, have the potential to be used in seawater desalination. With the right adaptations, they could act as a barrier to salts and other impurities, leaving behind clean, drinkable water. This could be a game changer in a region where water scarcity is a pressing issue, but the benefits don't stop at water. Consider the potential economic impact on healthcare. At present, the cost of kidney dialysis is a significant burden for many Egyptian patients. The membranes used in dialysis machines are imported at a high cost, driving up the price of treatment. However, with the development of these new membranes from locally abundant agricultural waste, the cost of dialysis could be substantially reduced. This would make the life-saving treatment more accessible to those who need it most. Yet, as promising as these innovations are, scaling up production to meet demand will be a challenge. The process of transforming date palm residues into effective dialysis membranes is meticulous and requires careful control. Translating this from a lab setting to an industrial scale will require significant investment and technological advancement. But challenges are not roadblocks. They are opportunities for creative solutions. One such solution could be to look to successful models from around the world, like Chinese technology transfer initiatives. These programs facilitate the exchange of knowledge and technology between research institutes and industries, fostering innovation and boosting production capacity. While there are challenges ahead, the potential impact on healthcare affordability and water sustainability in Egypt is undeniable. This breakthrough could herald a new era of innovation, using local resources to address local challenges and ultimately improving lives. Looking forward, what does the future hold for this innovative technology? The team of researchers in Alexandria have their sights set high. Their next target? The vast, untamed sea. They plan on harnessing their knowledge and expertise to develop membranes for seawater desalination, a process that's vital in arid regions where water scarcity is a pressing issue. This would be a game-changer, turning the seemingly endless seawater into a viable source of fresh, clean water. But this is no small task. It requires different specifications and a whole new set of challenges. Yet, the team is undeterred, fueled by the potential impact of their work. Beyond healthcare, this technology has the potential to ripple out into other sectors. Agriculture, for instance, could greatly benefit from affordable desalination processes, allowing for the cultivation of crops in regions once thought barren. Industries, too, could leverage this technology for various applications, opening up a myriad of possibilities. But the future isn't just about what the technology can do. It's also about where it can go. Egypt, with its rich history and strategic location, is poised to become a major market for membrane technology. Local production of these membranes could significantly reduce costs, making vital treatments like kidney dialysis more accessible to those who need them most. It's a win-win situation where the country benefits both economically and socially from a homegrown innovation. The road ahead is certainly not without its challenges. Scaling up production, ensuring consistent quality, and navigating the regulatory landscape are just a few of the hurdles that need to be overcome. But with the right support, investment, and a little bit of that famous Egyptian tenacity, these obstacles can be transformed into stepping stones leading to a brighter, more sustainable future. With continued investment in research, this breakthrough could transform the landscape of healthcare and water sustainability in Egypt. The potential is immense, the possibilities endless. It's an exciting time, a time of change and progress, and we can't wait to see what the future holds. In conclusion, this innovative technology holds immense potential. The groundbreaking research undertaken by the team at the National Institute of Oceanography and Fisheries in Alexandria, Egypt, has led to the development of advanced membranes for kidney dialysis machines. These membranes, ingeniously made from locally abundant date palm residues, have the potential to revolutionize healthcare in the region. The approach is innovative and resourceful. The membranes, which act as semi-permeable barriers, allow waste products and excess fluids to pass through, while retaining essential blood components. This is the same function performed by expensive imported membranes, but at a fraction of the cost. The team has shown that using resources readily available in the region can not only solve a health problem, but also contribute to economic sustainability. The production process, as explained by Dr. Amani El Sakeli, is another highlight of this research. The team has found a way to convert cellulose extracted from date palm residues into cellulose acetate using a novel catalyst, ammonium ferric sulfate. This process creates robust membranes that are suitable for use in kidney dialysis machines. The potential impact of this research is far-reaching. As Dr. Ahmed El-Namer pointed out, locally produced membranes could significantly reduce dialysis costs for Egyptian patients. Beyond the immediate healthcare impact, the team is also looking at the larger picture. They are planning to develop membranes for seawater desalination, which would contribute to water sustainability in the region. In the face of challenges in scaling up manufacturing, experts like Dr. Ahmed Hassanein propose looking towards successful models, such as Chinese technology transfer initiatives. This is a testament to the team's commitment to turning their research into a viable, large-scale solution. This is a prime example of how innovative research can lead to breakthroughs that have the potential to revolutionize healthcare and sustainability. Stay tuned for more exciting developments in this field.
As the sun rises over the bustling city of Cairo, a new era dawns in healthcare innovation. Picture this, a city that never sleeps, where ancient history and modern life collide in a vibrant tapestry of culture, tradition, and progress. This is Cairo, the heart of Egypt, a country where the urgent need for affordable kidney dialysis solutions is felt every day. With over 650 cases per million, Egypt's demand for accessible, life-saving treatment is palpable. Enter Dr. Safa Ragab and her team of dedicated researchers. This group of visionaries is not just answering the call for solutions. They're redefining the very approach to kidney dialysis. They're not just reacting to a healthcare crisis. They're actively shaping the future of medical treatment. They're not just healthcare professionals. They're pioneers on the frontier of innovation. The spirit of Cairo, its relentless energy, and the urgency of the healthcare challenge fuel Dr. Ragab and her team's determination. The bustling cityscape is their backdrop, the pressing healthcare needs their motivation, and the potential to drastically improve the lives of countless patients their driving force. The team, led by Dr. Ragab, is armed with more than just determination and ingenuity. They carry the hopes and lives of millions in their hands. Each experiment, each late-night discussion, each moment of discovery brings them one step closer to their goal. Their mission is clear: to revolutionize kidney dialysis. Their method? Pushing the boundaries of membrane technology. They're not just seeking to improve existing methods. They're striving to create something groundbreaking, something that could change the face of kidney treatment as we know it. Their shared commitment to patient welfare pushes them to explore the boundaries of membrane technology. They are the torchbearers of a new dawn, illuminating the path to a better, healthier future. And as the sun breaks over the Cairo skyline, so too does the promise of a new era in healthcare innovation. Armed with determination and ingenuity, the researchers have unlocked a novel method. A method that combines the traditional with the cutting edge, the local with the universal, and the simple with the complex. Dr. Amani El-Sakili, an integral part of this dedicated team, leads the way in this remarkable innovation. Here's where the magic happens. Picture date palm residues, often regarded as mere waste, now taking center stage in a groundbreaking medical solution. These residues, abundant in the Egyptian landscape, have been transformed into cellulose acetate membranes. These membranes are not just any membranes. They are the heart of a kidney dialysis machine, responsible for filtering waste from the blood of patients suffering from kidney failure. Dr. El-Sakili's process is a testament to ingenuity and resourcefulness, turning an overlooked byproduct into a potential lifesaver. But it's not just about creating something new, it's about creating something better. The cellulose acetate membranes produced from date palm residues have proven to be more efficient and safer, with fewer side effects than traditional dialysis membranes. The implications of this innovation are immense. Imagine a world where dialysis treatment is not just more affordable, but also more accessible, where patients no longer need to worry about the financial burden of their treatment or the availability of dialysis machines. This is the world that Dr. El-Sakili and her team are tirelessly working towards. But they're not stopping there. The team is continuously refining their process, striving for even greater efficiency and safer outcomes. They are driven by a shared commitment to patient welfare, a belief in the power of innovation, and a vision of a future where kidney dialysis is no longer a barrier, but a bridge to a healthier life. This breakthrough holds the promise to revolutionize dialysis treatment. It's a beacon of hope, a testament to the power of innovation, and a symbol of a new dawn in healthcare. The journey is far from over, but with each step, the goal becomes clearer and the future brighter. Join us as we delve deeper into this remarkable journey of discovery, innovation, and transformation. But the transformation extends beyond the medical. Dr. Ahmed El-Nemr underscores the potential economic impact. Imagine the financial burden of needing kidney dialysis. It's a costly process, often leaving patients and their families struggling to keep up with expenses. But what if there was a way to make this life-saving treatment more affordable and accessible? Enter the groundbreaking work of Dr. Safa Ragab and her team. By developing a novel method for producing cellulose acetate membranes using date palm residues, they are revolutionizing dialysis treatment. Not only does this innovation bring hope to those in need of dialysis, but it also has the potential to reshape the economic landscape of healthcare in Egypt. Let's delve deeper into this. The cost of dialysis is a significant barrier for many Egyptians, particularly those in low-income communities. High costs often mean limited access, and limited access can lead to dire health consequences. Economically, this puts a strain not only on patients and their families, but also on the healthcare system as a whole. But with this new method of producing dialysis membranes, we see a promising shift in the horizon. Date palm residues, a locally sourced and abundant material in Egypt, provide a cost-effective alternative to the traditionally used materials. This could substantially bring down the cost of dialysis, making it more accessible to those who need it most. Furthermore, this innovation has the potential to stimulate the local economy. The production of these membranes could create jobs, boost local industries, and open the door for further research and development in the healthcare sector. Dr. Ahmed El-Nemr emphasizes that this is about more than just cost savings. It's about improving the quality of life for kidney patients across Egypt. It's about giving them hope, giving them a chance to live healthier, fuller lives. The promise of affordable, life-saving treatment lies on the horizon. As we continue to explore the economic impact of this innovation, one thing is clear. This is a game changer for healthcare in Egypt. The dawn of a new era is upon us, one where affordable, accessible healthcare is not just a dream, but a reality. Yet the path to industrial-scale manufacturing is not without its challenges. The journey from a remarkable concept to real-world application is often fraught with hurdles. As we venture into the world of large-scale production, the complexity and intricacy of the process become evident. Imagine scaling up a process from a laboratory setting to a full-blown industrial facility. The challenges are multifold, encompassing technical, financial, and logistical aspects. On the technical front, maintaining the quality and consistency of the membranes is paramount. As we move from producing a handful of membranes in a lab to thousands in a factory, ensuring each membrane meets the required standard becomes a Herculean task. Financially, the initial investment needed to set up a manufacturing facility can be substantial. Acquiring cutting-edge machinery, training personnel, and ensuring regulatory compliance all come with hefty price tags. However, the potential return on investment, both in terms of financial gain and societal impact, makes this endeavor worthwhile. Logistically, sourcing raw materials, managing inventory, and coordinating between different departments can be a complex jigsaw puzzle. It requires adept management and efficient systems to ensure smooth operations. But as the saying goes, every problem has a solution. Strategic partnerships can be the key to unlocking the door to industrial-scale manufacturing. Collaboration with industrial partners can provide the necessary technical expertise and financial support to scale up production. Moreover, partnerships with educational institutions can facilitate research and development, leading to continual improvement in the manufacturing process. Technological expertise is another potent tool in our arsenal. Leveraging advanced machinery and automation can help maintain quality while increasing production volumes. Technological advancements can also streamline logistics and inventory management, making the entire process more efficient. So, while the path to industrial-scale manufacturing may be strewn with obstacles, with collaborative efforts, these hurdles are not insurmountable. With determination, ingenuity, and a shared commitment to improving patient welfare, we can make this vision of affordable, locally sourced dialysis treatment a reality. Inspired by successful international models, a promising future is envisioned. A future where Egypt, a land known for its pyramids and ancient wisdom, leads the global landscape in membrane technology. Dr. Ahmed Hassanain, a beacon of this transformative vision, believes in the immense potential of his homeland to reshape the narrative of healthcare innovation. Ever mindful of the challenges that lie ahead, Dr. Hassanein remains steadfast in his conviction. His faith is not merely in the technology itself, but in the indomitable spirit of his fellow researchers, the resilience of the Egyptian people, and the potential of homegrown solutions. The magic lies in the marriage of ancient wisdom and modern science, a blend that Egypt uniquely possesses. Dr. Hassanein's vision extends beyond the borders of Egypt. He imagines a world where affordable, effective dialysis treatments are not a privilege, but a right. A world where no kidney patient has to choose between financial solvency and life-saving treatment. This is not just a dream, but a tangible reality within our grasp. The journey towards this reality is not a solitary one. It involves the tireless efforts of researchers, the support of strategic partners, and the collective will of a nation. It is a testament to the power of collaboration and the strength of shared vision. Egypt, in Dr. Hassanein's vision, is not just a participant in the global healthcare dialogue, but a protagonist. A nation that does not just follow in the footsteps of others, but creates its own path. A nation that does not just consume technology, but produces it. A nation that does not just survive, but thrives. In the pursuit of accessible healthcare, Egypt stands at the precipice of a new era. An era where patients are empowered, lives are transformed, and innovation flourishes. An era where Egypt moves from the shadows into the spotlight, taking its rightful place on the global stage. Join us on this remarkable journey as Egyptian brilliance takes center stage in revolutionizing kidney dialysis.